So if you suspect your dog has eaten a foreign body or eaten something he wasn't supposed to, one of the more common clinical signs we see are vomiting, sometimes they'll be nauseous and drooling, and sometimes you'll just see them off of food. So if you suspect that, you'll come into the emergency clinic, and the more common thing that we'll do, the first diagnostic, is a physical exam. We'll feel the dog's belly, take a good look at the dog, and sometimes you can actually feel a foreign substance in the dog's belly. Another less invasive way of doing things is taking an abdominal x-ray. So taking an x-ray of the belly, if there's anything that's abnormal in there, like a rock or a bone or a stick, we can see that. Now sometimes you can't see it on an x-ray, and what we'll do is we'll do what's called an abdominal ultrasound. And that is like when a woman gets a sonogram to look at the baby. And we look at the small intestines and see if there's anything in there that's not supposed to be in there. If we identify something that's not supposed to be in there, then the next step is removing it. So the most common way is doing a surgery, and we make an incision in the dog's stomach or small intestine and remove the foreign object and stitch everything back together. Another less invasive way is this here, is using a scope, doing what's called endoscopy. And we'll actually take this scope here, which has a special instrument port to grab the item, and then a camera to look at things. And it's a non-invasive way of going down their throat, grabbing something out of the stomach, and then pulling it out. They're two most common. This is less invasive. It's more limited to the stomach. You can't remove anything out of the small intestine. Surgery is the gold standard. So you can actually look at everything really nicely and remove things as you see fit and take care of things. Those are the two most common ways that we address those, and that's what you can expect when you come to the emergency clinic.